Stoicism, an ancient philosophy, is revolutionizing modern healthcare. But what if this 2,000-year-old wisdom could actually save lives in today's hospitals?
Wow, that's a bold claim. How exactly is an ancient philosophy making waves in such a cutting edge field?
Well, it all comes down to the core principles of Stoicism and how they align with the challenges faced by healthcare professionals. You see, Stoicism emphasizes rational thinking, emotional balance, and accepting what's beyond our control, all crucial skills in medical practice.
Hmm, I can see how that might be useful. But how does it actually work in practice?
Great question. Let's take the Stoic principle of the dichotomy of control. In a medical context, this might mean a surgeon focusing entirely on performing the best possible operation, rather than worrying about factors outside their control, like the patient's overall prognosis.
That makes sense, but doesn't medicine require some level of emotional engagement? Patients need empathy after all.
Absolutely. And that's a common misconception about Stoicism. It's not about emotional detachment, but rather about what researchers call clinical empathy. It's a balanced approach that allows healthcare providers to remain objective while still showing appropriate emotional support.
So it's more about managing emotions than suppressing them?
Exactly. And studies have shown that doctors who take this balanced approach have better mental health and provide improved patient care. It's about finding that sweet spot between professional distance and genuine human connection.
That sounds challenging. How do healthcare professionals learn to strike this balance?
Well, some medical schools are now incorporating Stoic principles into their curricula. They might teach techniques like negative visualization, where doctors imagine worst case scenarios to better prepare for challenging situations.
Interesting. Does this approach actually lead to better patient outcomes?
The research suggests it does. Healthcare facilities that have implemented Stoic training programs are seeing higher resilience and empathy scores among their staff. They're also reporting better patient satisfaction metrics and improved clinical decision making outcomes.
That's impressive. Are there any specific areas of healthcare where Stoicism seems particularly beneficial?
Absolutely. It's proving especially valuable in high stress environments like emergency rooms and intensive care units. In these settings, the ability to remain calm and make rational decisions under pressure is crucial. Stoic principles provide a framework for maintaining composure in these challenging situations.
I can see how that would be incredibly useful. But what about the day to day interactions between doctors and patients?
Great point. One area where it's making a big difference is in communication. Stoic inspired approaches emphasize active listening, clear and compassionate language, and cultural sensitivity. These skills are essential for building trust and improving doctor patient relationships.
That sounds beneficial for both healthcare providers and patients. Are there any downsides to this approach?
Like any philosophy or approach, it's not without its critics. Some worry that an overemphasis on emotional control could lead to a lack of empathy. However, proponents argue that true Stoicism actually enhances empathy by allowing practitioners to engage more fully with patients without becoming overwhelmed.
I see. How do healthcare organizations ensure they're implementing these principles effectively?
That's where measurement comes in. Many organizations are now using specific metrics to track the impact of Stoic practices. They're looking at things like patient satisfaction scores, staff resilience measurements, and clinical outcome indicators. There's even a specialized tool called the Pathak-Wheaton Stoicism Ideology Scale that measures implementation in areas like taciturnity, endurance, serenity, and death indifference.
Wow, I had no idea it was being studied so systematically. What have these measurements revealed?
The results are quite encouraging. Healthcare professionals trained in Stoic principles are showing better emotional well being, improved handling of workplace stress, and a stronger sense of professional purpose. On the organizational level, we're seeing better team collaboration, more efficient resource allocation, and higher overall care quality.
That's fascinating. It sounds like Stoicism is offering some real tangible benefits to healthcare. But I'm curious, how does this ancient philosophy fit with more modern ethical frameworks in medicine?
That's an excellent question. Interestingly, Stoicism aligns quite well with existing medical ethics frameworks. Its emphasis on virtue and rational decision making complements principles like beneficence, non maleficence, and respect for patient autonomy. In fact, some argue that Stoicism provides a more robust philosophical foundation for these ethical guidelines.
I never would have made that connection. Are there any specific ethical dilemmas where Stoic principles have proven particularly helpful?
Absolutely. Take end of life care, for instance. These situations often involve complex decisions about continuing or withdrawing treatment. Stoic principles can help healthcare providers navigate these challenging scenarios by focusing on what's truly in the patient's best interest, rather than being swayed by emotional reactions or fear of mortality.
That makes a lot of sense. It seems like Stoicism could be a powerful tool for dealing with the emotional toll of working in healthcare. Is burnout a big issue in the field?
Unfortunately, it is. Studies show that about 58% of medical residents experience burnout. It's a serious problem that affects not only the well being of healthcare providers, but also the quality of patient care. This is where Stoic practices can make a real difference.
How so?
Well, Stoicism teaches practitioners to focus on what they can control, like the quality of care they provide, rather than worrying about factors beyond their influence. This shift in perspective can be incredibly empowering and help reduce feelings of helplessness that often contribute to burnout.
That's really interesting. But I'm wondering, how do these Stoic principles translate to the organizational level? Healthcare systems face some pretty significant challenges.
You're absolutely right. Healthcare organizations are grappling with issues like workforce shortages, regulatory compliance, financial constraints, and the need to integrate new technologies. Stoic philosophy provides leaders with a framework for addressing these challenges calmly and rationally.
Can you give us an example of how that might work in practice?
Sure, let's take resource allocation, which is a constant challenge in healthcare. A leader applying Stoic principles would focus on making rational, ethical decisions based on available data, rather than being swayed by emotional or political pressures. They'd also be better equipped to communicate these difficult decisions to staff and stakeholders.
I can see how that would be valuable. But doesn't this emphasis on rationality and control conflict with the need for innovation and creativity in healthcare?
That's a common misconception. In fact, Stoicism can actually foster innovation by promoting clear thinking and resilience in the face of setbacks. Healthcare leaders who embrace Stoic principles are often better at encouraging open dialogue, continuous learning, and improvement within their teams.
That's really fascinating. It seems like Stoicism offers a comprehensive approach to many of the challenges in healthcare. Are there any potential drawbacks or criticisms of this approach?
As with any philosophy or approach, there are certainly critiques. Some worry that an overemphasis on acceptance and control could lead to complacency or a lack of urgency in addressing systemic issues. Others argue that the focus on individual virtue might detract from efforts to address broader societal factors affecting health.
Those are valid concerns. How do proponents of Stoicism in healthcare address these criticisms?
They often point out that true Stoicism isn't about passive acceptance, but rather about taking effective action within one's sphere of influence. As for the focus on individual virtue, many argue that personal growth and systemic change aren't mutually exclusive. In fact, they can be mutually reinforcing.
I see. It's a nuanced discussion. As we wrap up, I'm curious about the future of this approach. Do you think we'll see more integration of Stoic principles in healthcare moving forward?
Based on the current trends and research, it seems likely. The healthcare field is always looking for ways to improve patient care and support its workforce. If Stoic practices continue to show positive results, we might see them become a more standard part of medical training and organizational culture.
That's exciting to think about. It's like we're witnessing the evolution of healthcare in real time, drawing on ancient wisdom to meet contemporary challenges.
Absolutely. And it's not just limited to healthcare. We're seeing similar applications of Stoic principles in other high stress fields like business leadership and military training. It speaks to the universal relevance of these ideas.
Well, this has been an eye opening discussion. Any final thoughts on this fascinating intersection of ancient philosophy and modern medicine?
I think the key takeaway is that while healthcare continues to advance technologically, the fundamental human challenges, making difficult decisions, managing stress, maintaining empathy, remain constant. Stoicism offers a time tested approach to these perennial issues. As we move forward, integrating this ancient wisdom with modern medical knowledge could lead to more resilient healthcare professionals and better patient outcomes. It's a powerful reminder that sometimes looking to the past can help us solve very modern problems.